In this video, we discuss TILs during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. The idea underpinning tumor infiltrating lymphocytes, TILs, is exceedingly simple. Why not take immune cells, lymphocytes, inside a resected tumor, replicate them, and inject them back into the patient? If these lymphocytes have infiltrated a tumor once, perhaps with enough of them, they can do it again and destroy the tumor. Incredibly, this concept has been tested successfully in clinical trials since the late 1980s. In 1988, the first trial of TILs induced remission in 11 of 20 advanced melanoma patients. This rate of remission is impressive to this very day, and was certainly greater than any treatment against advanced melanoma at the time. One company inching TILs toward FDA approval is Iovance, who produced the TIL product Lifileucel. Lifileucel produced a 36.4% response rate in metastatic melanoma patients who had already received treatment with a targeted therapy and immune checkpoint inhibitor. 54% of these patients had stable disease for an 80% disease control rate. These were patients who had no other treatment options according to the standard of care. In another trial with refractory melanoma patients, when TILs were paired with the immune checkpoint inhibitor Keytruda, it produced a response rate of approximately double of what Keytruda would have been expected to produce alone. TILs also induced an intracranial response, meaning it destroyed brain tumors in 28% of melanoma patients with untreated brain tumors. Although Lifileucel is closest to FDA approval in melanoma, it and other TIL products are being tested across a variety of solid tumors. Despite 35 years of clinical data, there are still no ongoing Phase 3 trials on TILs anywhere in America. There is one place in the world that offers TILs to medical tourists. Unfortunately, it happens to be one of the best hospitals in the world, Sheba Hospital in Israel. Costs are between $50,000 and $100,000 US. One concern for TIL treatment is that the tumor resected has to be large enough to have an adequate number of TILs. Usually, the minimum dimensions for a tumor to be used to generate TILs is about 2 centimeters x 2 centimeters. It also takes around 3 weeks for a proper number of TILs to be produced from the sample. Planning also needs to be made before the surgery to have the tissue sample taken to an approved laboratory to begin the TIL expansion process as quickly as possible. For more information about TILs, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.